What should you not say at a C&P exam? Well, don't lie and don't stretch the truth. If you're normally clean cut, shave once a day like I do and got a clean shirt on, cowboy hats dusted off, this is exactly how I would go to my C&P exam because this is the way I am on a daily basis. I wouldn't show up in a suit and I wouldn't show up looking like I'm homeless. If you're in a suit all the time, then wear your suit. If you're homeless and you look homeless, then show up like that. But don't pretend to be something you're not. That strategy, that's my boot camp. That's what I talk about. I preach it and I teach it. Here's another thing you should not say at your C&P exam. You should not be answering questions that you weren't asked. You should say as little as possible as well. Combat Craig, do you have pain? Yes. Not? Yes. Funny story. Let me tell you, it started in Vietnam, it started in Desert Storm, and then it's in my foot. And like you're filing a claim for depression. You don't need to walk through and paint this story about your whole body. This is a depression claim. If you want to go file a claim for your back, different claim, different C&P examiner. This isn't even the right guy. A psychologist is a head shrinker. An orthopedic doctor, you know what I mean? Like the doctors don't even cross over. They stay in their lane. So you stay in your lane. Don't answer and offer information that you're not asked about. Just answer the questions. Don't lie or stretch the truth. Be honest. Just answer the questions. If you're going in for a mental health exam, talk about your mental health. Don't talk about your back pain. If you're going in for back pain, don't talk about migraines or mental health. Or anything. One claim at a time, right? Keep it simple. There's a lot coming at you. You have to, get a beat on this guy and figure out what he's really doing, what questions he's asking. You got to nail it. You got to ace your C&P exam. So don't make it confusing and don't add in any information that doesn't need to be there. If you show up for an orthopedic C&P exam and the doctor starts off by handing you a piece of paper that says, hey, I need you to sign this. I used a goniometer on you. One of these things, a protractor thing to measure your range of motion, and then he doesn't use it, that could potentially be an inadequate C&P exam. You need to pay attention to stuff like this. If they don't use one of these things, then don't sign a piece of paper saying, oh yeah, they use one of these things. Goniometer, look it up, be familiar with it. If you need a doctor that can help you with a Nexus letter, check out my med team. Here's an email address. Hit them up. Tell them you need a Nexus. You're never going to see this examiner again. So if you're going in for your back or whatever kind of orthopedic condition, this guy may say, how far can you bend over? If on your normal day or your worst day, whatever your average day is, my back doesn't move a whole lot. Neither does my neck. Hey, Combat Craig, can you touch your toes? If you can't touch your toes, like every day because you work out and touch your toes, don't be a hero in there. This isn't the military anymore. If you go down and you filed a claim saying you have no range of motion and you're just popping down and touching your toes, you're going to get a 0% rating at best. Don't move into the pain. Be aware of what he's asking you to do. If you need notes, that's fine, but at least listen to the questions, and before he ask you to do something, yeah, I don't normally do that. Well, go as far as you can go. All right, that's as far as I could go. Really? That's all you could do? Yeah, that's all I could do. And leave it like that. Don't be adversarial, but don't let him move you into pain positions way past your normal amount of pain.